9 months into the pandemic, there may be hope on the horizon. Tonight, healthcare officials join Tim Seaman and Sophie Erber to discuss the latest information on vaccines, as well as new treatments. Coronavirus, fighting a pandemic, starts now.
Good evening once again, and welcome to our latest town hall event tonight, Coronavirus Fighting a Pandemic.
It was 9 months ago that we added COVID-19 to our daily vocabulary. Not until now, all these weeks later, is there serious light at what we hope is the end of the tunnel. The COVID-19 vaccine is due to arrive in Siouxland in the coming days.
That is what we're hearing, and joining us to discuss the creation, approval, and the realistic distribution of a vaccine and to discuss the therapeutics to fight against the virus right now, 2 local healthcare officials who remain in the middle of the fight of coronavirus. Joining us tonight are Dr. Larry Volz, Chief Medical Officer at Mercy One Siouxland.
And Mary Captain Dowland, the CEO at Siouxland Community Health Center. And we want to say first thanks to both of you folks for taking time out of what we know are very busy schedules these days to be with us tonight and provide some new information and update folks in Siouxland as this vaccine appears to be on the horizon right here in Siouxland.
That's right. Before we go any further, though, we do want to remind you that we want to hear from you. So let us know what questions you have right now about COVID-19. You can submit a question right on our Facebook page. That is facebook.com/KCAU9 News. And we will try to have our guests answer your questions during this town hall event. Of course, time is limited, but we want to get to as many as possible. Let's take a look now at some of the important numbers to remember. According to a weekly hospitalization record by Siouxland District Health, the week of November 13th saw 47 new COVID-19 admissions, almost double the number of admissions from the week prior to.
Woodbury County reported its highest number of new admissions in 1 week period during the month of May.
We also have found that Sioux City's 2 hospitals have a total of roughly 350 staffed hospital beds. Woodbury County also recording 15 deaths over the past week.
To get started, we want to turn to Dr. Larry Volz from Mercy One Siouxland. And if you could give us an idea tonight, Dr. Volz, the status tonight at our local hospitals. In the last 2 weeks or so, we've talked a lot about more cases and emergency rooms and ICUs that are approaching a capacity level. Where are we tonight?
Yeah, so I think the hospitals really are not quite as busy as we were probably a week or 10 days ago. About 10 days ago at Mercy One, we had our peak of inpatients that we've had ever since the COVID pandemic started. And that number has actually fortunately come down since that time period. And I think, ER volumes overall are down, but COVID visits, really remain pretty steady. So the hospitals are busy. Our ICU volumes are very full. We feel where we're at now that we're safe, that we're able to take care of patients well. We're not in crisis mode right now. We're a little nervous about this post-Thanksgiving surge that we're all sort of waiting for and seeing whether that's going to come or not. So we're sort of holding our breath in hopes that we can kind of stay at the level that we're at.
Hard to pinpoint an exact time, of course, when things took a turn, but in recent weeks and about a month ago in some of our states here in the tri-state area, the governors have, increased mandates or gone back to levels of some time that we saw in the spring here. Do you think that's helping slow that spread or have those numbers come down to more manageable numbers for you? Do you think it's made a difference?
I do think it makes a difference. I think every bit of those sorts of mandates where we're making people really distance further, make sure they're wearing their masks, and maybe people are being a little more aware as this has sort of blown up more across the country. But we're seeing a decrease, temporarily right now, and whether this is an actual trend or either way, we'll take the slight decrease. But I do think it does make a difference, absolutely.
Siouxland Community Health Center has been at the focal point of testing in the Siouxland community. And Mary, I want to turn to you as we get started here on that. Let folks know the sheer volume of numbers that you've been doing in testing at the center, and where are you today? Do you continue to see those types of numbers?
Well, Tim, thanks for having me, and thanks for talking about what we are doing as a community health center to really collaborate with our other healthcare partners to provide testing. So to date, we have done over 26,000 tests in the Siouxland region, and we continue to see several hundred that we're doing a week. There are more providers in the community that are testing now as testing has become more available. But I think what is a tribute to this community is that all of us as healthcare providers work together so that we saved PPE for the hospitals when they were taking care of seriously ill people. And our part was to make sure that people had testing available so that they could take their precautions as quickly as possible. So we continue to offer the testing, and it takes about 5 minutes to get a test. So we encourage people, if they're having symptoms or if they've been exposed, to make sure that they do get tests because they're available.
And it's really important to also tonight note the dozens and dozens of staff members that both of you represent in your organizations that on a daily basis have been there to help fight this virus as we continue to move forward.
That's right, since the very beginning. Now, looking back at the beginning when a lot of hospital staffs across the country, and of course right here in Siouxland, were very overwhelmed. PPE was limited, of course, before things like you just said were implemented. Compare, if you can, to that first surge of patients that you saw and how things have changed now. At least we're hearing for the better with new therapeutics being offered to COVID patients, especially those considered at risk. How are you better able to serve those patients now than you were back when this started?
Yeah, Mary and I were just discussing this before we came back, how different it is now. Believe me, the hospitals and the community is still stressed around this, but it's a different type of fear. I think we're more comfortable with COVID now. A lot of things that industry has done to really help us get through this, providing enough PPE. Initially, we were just trying to figure out how to reprocess our N95 masks so we'd have enough to get us through, and not knowing whether we were going to get more and where were we going to get supplies, and really sort of adapting to this, and how do we create units that are isolated, and how do patients or our staff change protective equipment coming in and out. Just all these processes were so new to us that part was much more overwhelming. And I think even though our numbers that we peaked at 10 days ago were the highest we had, there's a different level of fear and anxiety around that. I think, though, it's different challenges, because right now, you know, at the beginning it was sort of not exciting, if you will, but there was a lot of energy around that. And I think right now, staff, community, everyone is just exhausted with it. And I think that part is the challenge that we're having to get through, really with I think, you know, in the outpatient world and in the inpatient world, making sure that our people are really being taken care of, because this part is emotionally just drawing on the entire organizations. And I think that's going to be one of our biggest challenges, I think, going forth as this drags out.
Maybe getting people over some of that right now. There is a lot of hope that we've been talking about on the horizon. Vaccines, some of them arriving in certain states as soon as this week, focusing specifically on Iowa. Governor Kim Reynolds, she talked with state leaders. There's a plan, at least a preliminary plan, to distribute roughly 170,000 doses of the vaccine. Either one of you, I'll open this up to talking about that.
And let's take a look. We do have a graphic that spells out the plan as far as the way that the vaccine will be distributed. There is a hierarchy that's been presented so far, Mary, and I know the Siouxland Community Health Center will be really an epicenter of distribution once this begins. So if you want to maybe touch on, you can see right there on the graphic some of those initial demographics that will be receiving or be possibly eligible. But Mary, how would you address that as it approaches?
Well, health centers across the country are being asked to be really a big part of the infrastructure, and we're working with the health department and our other community partners. So the big thing is that there will be phases for that distribution of the 170,000 doses, and the first phase is aimed at people who are working in healthcare. Our healthcare workers, as Dr. Vole says, are exhausted. They're exposed every day, and so we want to make sure that they're vaccinated first. And then it's our long-term care residents and our long-term care staff. They will really get the first shipment of the Pfizer vaccine that we're getting 26,000 doses of, and then there will be 85,000 doses to follow the next week with Moderna and with Pfizer. So total then after the next dose of 61,000, the 170, but it's very much prioritized for healthcare workers and for residents of long-term care facilities.
And how will medical facilities like yours, it was my understanding that the shipment would actually come to a facility like yours, and then you would be a distribution to a clinic or to a hospital. Is that how it still is playing?
There's 6 distribution sites in Iowa, and the first Pfizer vaccine does require very cold temperatures, 70 degrees below 0 Celsius. So the hospitals will be the people that, and the organizations that get the first doses because of their ability to be able to store the vaccine.
And the Moderna vaccine does not require that, is that correct?
The Moderna is not, as it's 20 degrees Celsius, which is much more in line with a lot of the other vaccines and doses that we have.
So, of course, one of our viewer questions tonight, a lot of people want to know, when available, will you get a COVID-19 vaccine? So 44% of people say no, 56% of people say yes. If you wanted to comment on some of these numbers, that is striking. Of course, the talk is all about vaccines and getting one, and yet roughly a 50-50 split of people saying yes, they want one, and no, they don't.
I think one of the things that we have to do is really recognize that the public has received a lot of misinformation during the COVID pandemic and a lot of contradictory information. So there's a lot of distrust and mistrust about the safety and the efficacy of the vaccine. So our job as healthcare providers is to create that sense of trust in the vaccine, to educate people. When we hear from the experts in public health that the vaccines are safe and they're effective, then we need to make sure that we're educating our populations. At the health center, we have many racial and ethnic minorities that, because of their histories with the healthcare system, have a reason for mistrust. So we need to make sure that we go out to the leaders in our community and really make sure that we start to instill that trust in people, start to take away that mistrust, and let them know that this will be safe for them, and this is hope that they haven't had for several months.
Briefly, too, some confusion is people hear the amount of doses that are coming, and then they hear that only half that amount of people will be able to get vaccinated. So briefly explain why that is, because we're hearing this will be done in 2 doses.
It will be in 2 doses. So most of the trials have been broken down. You'll get your initial dose, and then 21 to 28 days later, you'll get that second dose. And we really, the vaccines have been shown to be protective really within about 10 days of getting that first dose. Not completely effective, but to be as effective as that vaccine can be, you really need to get that second dose. And so people need to really commit that when we're doing that, they need to follow up in that 21 days. If you're waiting 60 days to get that second dose, it's probably not going to be as effective. And I think those numbers, that 50% number, is disheartening. You'd hope that everyone would be all in. We know we're not going to have enough vaccine the first day to vaccinate the entire country. So hopefully, as vaccine becomes more available, that the company or the members of the community will become more comfortable getting that vaccine, seeing that, all right, people are doing okay with the vaccine, and that as more vaccine becomes available, hopefully that by the time summer rolls around, we'll be at 80 or 90% of people getting that vaccine. But if we stay at this 46% number, that will not get us to a point where we can get back to living normal lives again.
I think one of the things that I hear in the community is, from those that are fearful of the vaccine, is, why would I want to put live coronavirus in me? And I think that's one of the misconceptions. That's not what happens with this virus, is it? No, it's not. And so the vaccines are not made from live virus. This is these are both what they're called mRNA vaccines. And so what they do is they take just a portion of this mRNA, and it creates the mRNA as a part of the sort of DNA, I guess, if you will, if people understand that term better, of a vaccine. And so it's not a live vaccine that they're putting into you. So at this point, these studies that the FDA, or that Moderna and Pfizer have done, have within large numbers of patients, 30,000, 40,000 people in those trials. Most drugs that go to market across all their trials really have maybe 3,000, 4,000 patients are tested. So this is actually an enormous number of patients that have been injected. Though we don't have long-term data, the short-term data looks to be very safe. And as I understand correctly, these are those mRNAs are actually similar to what's used in some type of cancer treatments today.
Yeah. So these are new types of vaccines, so we don't have tons of data around that, but at this point they're as effective as any vaccine that we've seen produced before, and the safety profile is online with every other vaccine that we have.
Well, that's some good news there. And we do have a Facebook question we want to pose to you too, along the same vein. So how long after a positive COVID-19 test can you get the vaccine? This will be a case for many people who have already contracted the virus, and they still, of course, want to potentially get the vaccine.
Yeah, I don't think we really have data on that yet. There hasn't been guidance that we have seen from the vaccine manufacturers, from the FDA, as far as that goes. I mean, I think recommendations around that are going to be that the thing we do know is that if you've had COVID in the past, you should still get the vaccine. Right. As far as timing, I think in that it's going to be that you should probably have really recovered from your first infection before you'd want to take that vaccine. But we don't have guidance yet on when it's safe to be able to do that.
Barry, I want to come back to you in the distribution of the vaccine. Obviously, the very limited number that will be coming initially, we know those are targeted to those closest to the virus. How long will it be, do you feel, before there is a broad approach to treatment? And Are you already receiving good feedback from partners in our community? As you mentioned, there are different demographics that have to be addressed, and that requires different partners and how that would be disseminated. So maybe tackle those two things for us.
Well, we are working and meeting every week as a community to really say, how are we going to make sure that the people who need it are prioritized effectively, and that we're all working together, and that we have some standard of care. So I am confident that this community, just like we did with testing, will rise and make sure that the distribution is going to be equitable and fair across the community. I think one of the things that we all need to be aware of is that we're anticipating all these doses, and the production of vaccines, we've been told for many, many months now by HHS, is very complicated. And there are going to be supply chain disruptions. There are going to be delays in getting the vaccine. So we are really saying we would love to have a supply in by April or May, but we really need to see what production looks like in this country. And they're telling us it will be more waves than steady streams of supplies.
Now, also talking about vaccines, we asked our viewers, do you worry about the time frame in which the COVID-19 vaccines, both Pfizer and Moderna and others, have been developed? 65% of people say yes, they are concerned about it. 35% of people say no. And Dr. Volz, as you've mentioned, this is kind of a new way to do vaccines, this mRNA. It's not the same as maybe that we saw during the H1N1 outbreak, you know, other vaccines that were made. So do people have, you know, cause to be slightly concerned? And also, why might they not need to necessarily be concerned?
Sure. So I think the issue around this is, I think in normal times where we were dealing with a very common disease that we've had for 100 years, right? And now we have a new treatment for that, and this drug was pushed quicker than typical. I think maybe there would be some more concern around that. Part of this is balancing the risks of every decision that we make. And it's something that we have to do in medicine every day, as we're balancing the risks of the treatment versus the risks of not treating at all. And I think balancing that risk. So is there a slight risk in taking a vaccine? There's a slight risk in every medicine that we take. But we have to balance that against the risk of overwhelming our facilities, staying where we're at, not being able to open up schools, maintaining social isolation again for years because we're not going to be willing to make any changes around us. And there's a significant amount of risk around that. And I think that part of this, I think it was initially politicized that we were going to try and run this vaccine through. I think the science around this, you have to have faith in the FDA, which is one of the most stringent approval processes of anything in the world. Trying to get drugs approved is following the science, and that all the people that live in this world and understand these vaccines know that they're safe and are willing to be able to put it out.
It appears at this point that children will not be part of at least the initial or the first several months of this distribution. Is that true? Sure.
So in these, when they're developing these drugs, they focus really on adults. We need to make sure that it's safe in adults. There have been some approval to be able to go to age 16. Moderna and Pfizer are working on their initially started trials in younger children, so 12 to 16. Once we have data in that 12 to 16 age group, then they would look to starting to vaccine sooner than that. Obviously, those children don't get sick. Some of them do. They're maybe at high risk. But the average child does not, but they are key carriers of the vaccine, so trying to vaccinate them really helps to contain the virus in the future. But it's going to be some months before we're able to start having a vaccine for children.
I'm curious, have you started to see anything yet from the UK? It's only been a couple of days, but we know it's being administered overseas. Is there any data that's being shared medically or with health professionals already?
I think the first injection was yesterday.
Right, it was.
So not much coming out of there yet.
I didn't think so, yeah. But as the world waits, right. I was wondering if perhaps there might have been some
attention has been on the king, or well, not the king, but Prince Philip and the Queen. They were set to receive their vaccines. We do have a viewer-submitted question for you here. Is it true, if you have COVID-19 and have had a positive test, can you be reinfected? Of course, across the country, we've heard a few cases of potential reinfections. If you care to comment on that, because that is a serious fear for a lot of people.
Yeah, so you can be reinfected. The risk of that at this point, from all the data that we've seen, is low. But I think now, our first cases were really in March, and so now we're 9 months. Would I be shocked if we're starting to see those cases rise again? We're not sure how long that immunity from your initial infection lasts, but you can be reinfected. And so once you've been infected, you still need to maintain maintain social distancing, it doesn't mean now that you can just get back to living however you want. We still need, and even if you were reinfected, could you transmit the virus again? We don't know those answers yet, but you can be reinfected.
And a quick question about reinfection and just having it and also getting a vaccine. We did have a viewer ask us today, actually, if they've had COVID-19, now they're a plasma donor, because that's an important part of the therapeutics now, because they have those antibodies. Should they bother getting a vaccine? Should they not?
Yeah, you absolutely need to get your vaccine. So, and most of the recommendations from CDC are, even though you've had COVID, the anticipation is that the vaccine will be more effective actually than actually having the infection. And so we're hopeful, but we were recommending once you've had COVID, you still need to get the vaccine.
Mary, I want to ask about the follow-up. This isn't, we've been getting flu shots for years. You go get it, you're done, and you forget about it. I have a feeling that's not going to be the case with the coronavirus, this vaccine. How will there be follow-up? How important will it be? And especially as you talk about really to be the most effective as possible with 2 different vaccines, 2 different applications.
So that's one of the things that we're working on, and what is going to be the way that we keep communicating to people. Actually, the CDC is going to put out a phone app, which is called V-Safe, that will allow people to really interact with their healthcare provider and be able to give data on vital signs, et cetera, and how they're feeling. So much like the trials have been, this will all continue. The research will continue. So the CDC is really developing very effective ways to be able to follow and to monitor people. And we as healthcare providers are going to be monitored too, to make sure that people are getting that second dose, as Dr. Voles referred to, and just making sure also that we are monitoring people to make sure that they're not adverse symptoms.
And Dr. Voles, to give us just an idea, again, I know we're very early, but with the flu shot, you're told you may have some soreness in your arm, you may, have some slight symptoms. Is there a prescribed set of guidelines for post-injection at this point?
So, I'm not sure if there's going to be a handout that you're going to get for sure, but the side effects that we're seeing, the most common one was pain at the injection site, and then there's other symptoms: muscle aches, joint aches, headache, and then about 15% of people had fever. And so when you get that vaccine, so particularly for healthcare workers or people, you're not going to be sure whether that fever was related to a new COVID infection that you hadn't had, or whether that's related to the vaccine. And so that number is not insignificant. 15% is a reasonable number. So we have to, I think as we're rolling that out, people are going to have to be aware of that if you had that fever and you just got the vaccine, that you got to be cautious a bit and make sure that those symptoms aren't persisting.
And we do have a viewer submitted question again from our Facebook viewers. It reads, is it true that you have to be close to someone for more than 15 minutes to contract COVID-19, or can you get it much quicker?
Yeah, so that's really just a guideline, as is all these rules are, and there's nothing that we can do. Even if you're staying away, from people and wearing a mask, those just decrease your risk of being transmitted. And it depends on what that contact is, how close you were. I mean, if you're next to somebody for a minute and they sneeze in your presence, right, that you can contract that in less than 15 minutes. So there's nothing magic that happens at 15 minutes where suddenly now that you can step out at 14 minutes and 30 seconds and you're going to be safe. So yeah, you can absolutely still get it.
There's a lot of positive chatter right now because of the vaccine. That's good. I'm guessing it also could be bad, though. Is there a concern that people are going to become lax in the other protocols because, the vaccine is here? How important is it to continue the regimen of masks, social distancing, and washing your hands?
That's a really important point, Tim, and I think that what we have told people is, we don't know when the vaccine is really going to be available to the general public in Siouxland, so we just need to keep being very, very vigilant, that we keep doing the social distancing, that we wear masks when we step out of our homes, that we do the hand washing that's necessary for us to do. We can't let down our guard now in anticipation of something that's still several months away.
And I wanted to ask you quickly, did you want to add something, Doctor?
I think along those lines that we have to remember the vaccine is not 100% effective either.
Right.
And so even after you get your vaccine, people are going to still have to be following protocols and being safe, because that risk doesn't go to zero. And I think that the challenge we'll have is as people get vaccinated and they stop wearing masks, now it's going to make it seem to be the norm. So I think even in that vaccinated population, we're going to still have to be diligent until we kind of sound the all clear that we're at a point that we can really start backing off.
And a slight focus off vaccines for a second. I wanted to go back to those those therapeutics that are being offered at some Siouxland hospitals. If you do get COVID-19, I know plasma donation is a huge part of that. If you want to briefly describe for our viewers what treatments you're able to offer some of those high-risk patients today.
Yeah, so on the inpatient side, since we started, we've been doing this convalescent plasma where patients that have been infected with COVID can give their plasma. There's been several other studies that have come out. There's a drug called remdesivir, which we can use now. There's also another drug with dexamethasone, which is a common steroid that we've shown, have all shown to decrease. And I think that's what we're seeing to be able to turn around some of how the inpatients are doing in recovering. There's an outpatient therapy that has been come out. President Trump had gotten this when he was at Bethesda. What they are is they're a manufactured antibody. They're not drawn from human subjects, and they're actually made. And then they are given out, but they're not given to patients that are really sick. In the studies that they did, the patients that were really sick really didn't do very well with that antibody. So what they found is that the people that got it before they became ill, they were at high risk for going to the hospital. So it's people that were older, so over age 65, if you had a body mass index of greater than 35, you had diabetes or immunosuppression, or you had other conditions, and your primary care doctor would know all of those criteria. But if we can give those to people before they become sick right away after they've been diagnosed, we can decrease their likelihood of progressing with the disease and now needing to be either admitted to the hospital or getting sicker in the hospital, ultimately going to the ICU or being ventilated.
So some hope for our viewers and also for healthcare workers who are trying to manage these case numbers. Thank you for answering that.
Yeah. We're in our last minute or so. So, Mary, I want to have you, if someone has a question, a concern, they need information about how the vaccines will be handled, what should they do?
Well, there are several places they can call. They can call the Community Health Center. They can call the District Health Department. They can go to the IDPH website. The Iowa Department of Public Health has excellent information and facts and questions that they will answer for you. So I would encourage people. There is a lot of information out there, and every day getting more.
And that's good to hear. And we want to pass along our thanks to the staffs of both of your departments, the work that your employees have been doing in these difficult months, and we're not through it yet, obviously.
Oh.
Yeah, stay safe. Thank you for joining us. And 30 minutes flies by, but again, we do thank you for joining us along with our panel here today. Of course, you can stay with us and still submit some questions to us. We'd love to have some story ideas from you, of course, at SiouxlandProud.com or news at KCAU-TV.com.
And of course, we will continue to follow this fight against coronavirus in the weeks and the months to come. We'll stay on top of getting you the important information once a vaccine is available right here in Siouxland, and we'll continue to follow the progress in this fight. Thanks for being with us tonight. And again, one final thanks to our panelists that were with us here for this special and important conversation.